Hello, and welcome to Tech Talk Community Conversations, the quarterly broadcast from Dr. Jill Bowen, Commissioner of the City of Philadelphia Department of Behavioral Health and Intellectual Disability Services, in which we explore the work DBHIDS and our partners do together to address the key components of TEC, which stands for trauma, equity, and community. So now let's learn about TEC. Dr. Bowen?
Thank you, Mark, and welcome. Welcome to Tech Talk Community Conversations, the series in which we explore how the work we do at DBHIDS and with our community partners aligns to address trauma, achieve equity, and engage community. Today, I am thrilled to be joined by Hector Ayala. Hector is CEO and President of Hispanic Community Counseling Services, and he's also chair of the Latino Behavioral Health Coalition. He has been helping to serve the people of Philadelphia for over 30 years. Hector, welcome. And why don't you tell us a little bit about your work here and how it aligns with the priorities of trauma, equity, and community?
Well, first and most, thank you very much for having me. Thank you for putting together this platform that provides resources, provides information, not only to community providers, but to community in general. So for that, thank you very much. So what can I say about Hispanic Community Counseling Services? We're not just, an ordinary outpatient mental health provider. We consider ourselves a beacon of hope, a multicultural haven, and a testament of the values of trauma-informed patient-centered care in every aspect of the work. ACCS, of course, embodies the priorities for trauma, equity, and community, creating a tapestry of healing and support here in North Philadelphia.
That's beautiful. That is just, I couldn't even capture all the words. It was just lovely. Beacon of help and also beacon of hope, and a tree, really the value or a testament of the value of trauma-informed work, because let's talk for a little bit about the trauma that is experienced by people that we serve.
Well, one thing that I have to say that when we talked about trauma, ACCS's approach in mental health care transcends the boundaries of language and or culture. We stand for a multicultural sanctuary where individuals from these diverse backgrounds can find understanding and services in a way that accommodates to their needs and to their wants. It's difficult in the mental health field when you're trying to actually come up with an approach that can satisfy individuals. So again, what we have done in conjunction with the Department of Behavioral Health and Intellectual Disabilities is that we have met people where they are. We come up with approaches that are made for them, and we pair them with the right professionals in order to address such difficult things, like talking about trauma. So when I reflect in the work that we have done and the goals that we have put in front of us as a community organization, an outpatient provider, I can share with you, many success stories about, how the implementation of some of these approaches have yield results, in immediate results in our community. For example, from the top of my head, I can think about I'm going to call her Maria for the sake of, privacy and confidentiality. She was a survivor of domestic violence, who carried the weight of trauma for many, many years. She always, this is something that she shared with us. She always hesitated to seek help until she discovered that we had a trauma-informed counseling program here. To make the story short, our dedicated therapist provided her a safe and empathetic space for Maria, and in which she was able to share her experiences. Through these tailored therapeutic approaches, which I mentioned earlier, Maria not only began to heal, but she became an advocate for other women here in the community. So that's just, when we talked about healing trauma, that's just one example.
That's a beautiful example. That's really puts a human face and experience on the incredibly impactful work that you do through your organization and also through the coalition. So let's talk for a minute, because you are definitely highlighting the inclusivity of your approaches for the community as a whole. You talk about meeting people where they are, whatever language they speak, you are there. Whatever trauma they've experienced, you are there. And also I think you talk about the treatment approaches, which are very trauma informed, very trauma responsive approaches. You also, I know, do a lot of connection to the community work. Can you speak for a little bit about that? Because I think that goes to the point of being trusted with some of the traumatic experiences that people have, that they keep close to they keep it close, and to allow somebody to come in to help with healing is really such an important part of the treatment process. So can you talk a little bit about your work in terms of looking at the community as a whole, in addition to the individual people and families who come for treatment?
You bring a very important point, Dr. Bowen. And in order to engage communities, you have to achieve equity. So the first thing that we focused was on making services accessible to anyone, despite their ability for them to pay. We have created, scales for patients. We provide a lot of pro bono hours of work because, again, it's about engaging people in treatment and engaging communities as well. So we have done, different type of things. As you may know, of course, we have conducted many mental health awareness campaigns in collaboration with many community providers, businesses, churches, schools, you name it. And the intent is, one, to break the stigma of mental health. Two, to show the community that services are, that we have services in the community that are tailored to their needs, to their language, and to their social economic status as well. The intent is that how through this awareness and these campaigns and these type of workshops, events, even our symposium that we do every year through the Latino Behavioral Health Coalition, they all are focused on one, putting in a pedestal the great things that are happening in the community, how these collaborations are working out for the community, and what are the results that they're yielding. But also, it's a way of connecting communities that otherwise, and they will never have this type of context. And it's about not only showing other communities how you can do certain things, but also, how you can also connect communities through services. We have, for example, through these collaborations, we have seen people in Erie, Pennsylvania, through one of our partners that is working on the west part of the of our state.
Right.
So, that's just one example. The collaboration that we do also in South Philadelphia. But it's just a culmination of when we put together these events, having hundreds of people participating, engaging, smiling, sharing with their families. That's what we consider what community engagement means, and how we measure the effectiveness and the success that we're having in that sense.
So we do know, like, healing happens in the community, and healing happens with the community, through the community. But you're embodying that, and it's really quite beautiful, the way in which you embody that, and you work on like every possible level. You clearly think 3-dimensionally and 4-dimensionally about the work, right? So for the work, and it was a wonderful experience to walk through your facility and talk to the staff that work here, many of the staff who've been with you for a really long time, the passion and the commitment and all of the challenges of the community, that you break down the barriers one after another. You just break down barriers to access through engagement. And just talking with some of the folks and them saying, why they're there. And it really is that internal sense of community, that sense of family from a provider view. And then you take that out almost like in concentric circles. So I'm impressed with the way, you work, with the agency, and then you take it wider to the community as sort of a natural way in which to engage folks in healing. And then through the coalition, you take it another level wider to the wider community, especially the Latino community. And then you take it wider beyond across the state, I know you've taken it internationally. It is really working at every possible level. So when we talk about engaging community, it's like I see it in bold letters when it comes to like capital, letters in bold letters, because it is an embodiment of your entire approach. And so when we talk about trauma and the trauma that folks who come to us for healing, and we talk about inclusion and equity, and we talk about engagement, it's really, if I would say like CET instead of TEC. It's like you're very community first, and you define that community in multiple ways, and that brings inclusion and breadth to your work.
Thank you for those kind words. But again, I think that you're right, you mentioned this earlier, the success that we have as an organization, not only providing outpatient mental health services in North Philadelphia to over 3,500 patients, but also combining forces with other 7 members of the Latino Behavioral Health Coalition has given us the opportunity to reach over 40,000 families and individuals on a yearly basis. We are located as a coalition in every single zip code here in the city. So what we're doing is taking advantage of those opportunities that we have, combining forces with these providers that are making great things and creating great programs in each corner of the city, and trying to enhance that, trying to put that on a pedestal, try to copy these approaches. I mean, if we see that it's working with X, Y, and Z, why not applying that here in our community? So this is why now, I mean, our work has taken us internationally. It's not just, in the Caribbean, but we have members of our coalition going to Asia and the Middle East, and putting out their approaches and working together with these other communities, which is something that makes us extremely proud as a coalition. But also, none of these things would happen if we didn't have great partners here in the city to make this happen. I mean, you guys, DBH has been a great partner of that, of acknowledging that to work with at-risk and healthy populations, working in non-treatment settings, that has been something major, creating the approach of wellness for all, not just for a few. And again, from, the engaging nurse of colors down to the, the community behavioral health screenings event and the crisis response center. And we are actually working together with your outreach and engagement teams here in North Philadelphia. This is how all these things happen, why they are making it possible. Is your efforts and your coming with this approach intentionally to create the impact and the change that we are starving for. And again, the community, clinicians across the board, clinical staff, administrative staff from all our organizations appreciate very much all the efforts.
Thank you. We appreciate that.
You guys are thinking in order to make this happen.
And it takes a village, right? I mean, it certainly takes all of us.
There is nothing comparable to what we have around the world with what we have here in Philadelphia. So this is something that you guys should feel extremely proud, because we can do these things, but it's because you guys are allowing us and giving us the tools to do this work. Thank you for that.
Wonderful. And so, what are you looking forward to in the coming year, now that we are still saying Happy New Year? I think we can still say that for the rest of the month, but what are you looking forward to most this year?
Well, first and most, we're aiming to expand our reach to impact further other communities and other individuals. We plan to enhance our trauma-focused interventions, increase our cultural competence as well. We have seen, how collaborating with communities that are not only Spanish have benefited us in learning how to reach these communities and these individuals. And we're going to continue strengthening our partnerships with the community. These are things that we feel that are the right tools to make a successful practice and to make our organization accomplish those goals that has to do with equity, providing trauma-informed practices, coming together to create change, and creating advocates. The work cannot just rely on us, but how now we train our communities to be advocates and to expand trauma-informed practices across the board.
Well, it sounds very exciting. So as always, it's such a pleasure to talk with you. Unfortunately, we're out of time, so I'm going to wrap and just say thank you. Thank you for your time today. Thank you for the work that you do for the people of Philadelphia, your community, beyond the community as a whole, the national community, the international community, and we really so much appreciate you here, right here in Philadelphia. And thanks to all for watching the DBHIDS Commissioner's Tech Talk. Our next Tech Talk community conversation will take place in April, when another guest will help us learn more about the work that DBH does with its community partners to address trauma, achieve equity, and engage community. So once again, thank you, Hector Ayala, Tech Champion.
You're very welcome. Thank you for having me.